Hi, I'm Dr. Nick Merrifield. I'm a GP at Holmwood Corner Surgery in southwest London, and this is just a short clip to talk about back pain and how we can help you help yourself to make things a bit better. Now, if you do a job which involves a lot of sitting down, like you're in an office, or you perhaps drive for a living, or if you're a keen gardener, there's a good chance that you'll have had some back pain, particularly lower back pain, at some point. It's very common. It affects almost everyone at some point in their lives, and is generally not serious. And it's something which you can generally deal with yourself without needing to come and see a doctor, and very successfully. So this is really here to help you do just that. The first thing, before we start, as doctors, we always think about some of the really serious things that can cause back pain. So the first thing is to make sure we get those out of the way first. And we call those things red flags. And red flags are symptoms or associations which make us concerned. And those are things you definitely need to see a doctor for, and sometimes as an emergency. These things would be if you've had cancer, particularly recently, or if you've having treatment for it now. If you're getting any problems with the bladder or bowels, like difficulty passing urine, or indeed you cannot pass urine. If you're getting, and those are really serious, you're at hospital straight away. If there are other things which are also concerning, like you're having a lot of pain in your legs, even if the leg pain is worse than your back pain, you'd want to come and see the GP. If the pain is getting worse, or if you're getting pain more at night than in the day, those things would be things you'd need to see the GP. If this pain was as a result of a really serious accident, like a high-speed car accident, or you've fallen a long way, clearly those things are concerning, and we need to make sure you haven't broken something, for example. Now, assuming all those things aren't the case, what do we do now? Well, as I say, lower back pain is the commonest place to get this. It tends to happen if you sit down a lot, maybe you're not as fit as you'd like to be, or you've injured it perhaps in the garden or doing some heavy lifting. And it can be really, really painful, but it generally will get better, even if it takes up to weeks, I'm afraid. Now, what do we do? There's a few things you can really helpfully do, and the first and most important one really is to keep moving, because actually sitting down for too long will stiffen up your back, it'll get tight, more painful, and actually you're not doing yourself any favours. It's better to keep active, keep moving around, avoid the heavy lifting, but keep doing your normal activities. If you're desk-based work, perhaps stand up every half hour, have a little shake, a little loosen, make everything a bit more loose, and that will definitely help too. Heat is often really helpful, so really hot bath, particularly first thing in the morning, is really good. Hot shower, hot water bottles, they'll help the pain too. And then painkillers are sometimes helpful too. Ibuprofen, paracetamol, those are things you can generally take, are very safe and are often really helpful. Sometimes good to take them regularly. So 4 times a day for the paracetamol, 3 times a day for the ibuprofen will help build up in your system, and actually will be much more effective than just taking the odd one occasionally. These things do generally get better. They can come and go a bit. But if after a few weeks you think this has not got better, or if you think it's getting worse, or indeed if you're getting a lot of pain down the leg, particularly if it's really persistently down the leg, then that's a really good time to come and see the GP. And we've got lots of things we might advise. Some people also find that other therapists can be helpful, physiotherapists, osteopaths, exercises, which can be found online. Have a look at nhs.uk, the website. That's got loads of really helpful information. And also, don't be too downhearted, because these things are pretty miserable sometimes when you're in pain a lot. Be positive. A good attitude will often help you too. Anyway, I hope this has been helpful. If there are things which you don't think this fits into, or you're concerned about something else, by all means come and see us at the surgery. But I hope this gets better, and good luck.